Here begins the deposition of Chelsea Feldhaus. Today's date is December 4th, 2020. Time on the video monitor is 13:51. The court reporter, please swear in the witness.
Can you please raise your right hand? Do you solemnly swear or affirm that the testimony you're about to give in this case will be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you.
Ms. Feldhaus, I'm doing Kelly. Excuse me, we've spoken before. You know I represent Ralph Mulder.
Yes.
And I'm going to be asking you some questions today, and if you answer my question, I'm going to assume you understood it. If you don't, please tell me you don't.
Okay.
And secondly, I'm going to assume you're answering my questions to the best of your knowledge and information. Will you also do that?
Okay.
Tell me a little bit about your professional background.
I graduated from Tennessee Tech University in December of 2016 with a Bachelor of Science in Nursing. From there, went to take my boards and got a job at Tenova Healthcare, Shelbyville.
And about what year would that have been?
That would have been around March 2017.
17. And when you went to work at Tenova, what department did you work in?
The ICU.
Let's talk now about Dr. Russell. Have you worked with Dr. Russell before?
I had taken care of some of his patients, only maybe a handful of times.
And they would have been in the ICU?
Yes.
All right. Other than that, that's all you know about him?
Yes.
When a patient is, like you said, is one of his patients in the ICU, what does the doctor normally do, Dr. Russell, when his patient's in the ICU? And by that I mean, does he check with you regularly, or how do you even know that that patient is Dr. Russell's?
It would typically say on their chart somewhere that he was the main consulted doctor.
Do you remember Ralph Mulder?
I don't remember the name. I remember various parts of the situation.
Well, let's talk about that for a minute. I know you don't remember the name. What is that calls your attention to the fact that you can remember parts about his case?
He was a complicated patient in the ICU. I tend to just remember the more complicated patients that I take care of.
Let's talk about the medical record now. And you have part of that record in front of you, but is the medical record supposed to be an accurate description of the condition of the patient in the ICU?
Yes.
And do you believe that the medical record in front of you is an accurate description of Mr. Mulder's condition in the ICU?
Yes.
When Mr. Mulder got, and I understand you don't remember his name, but when he got to the ICU, did you know what was wrong with him? Why he was in the ICU?
I remember in report the reason that he was admitted, yes.
What do you remember?
The procedure
Okay, tell me
for
what
which he was admitted for.
Tell me what you remember.
I believe it was angioplasty, so a vascular surgery.
Well, do most people have angioplasties end up in the ICU?
I don't know.
Okay. Let's talk about what your role was once a patient, and we're talking about Mr. Mulder, is admitted to the ICU. What is your role?
My role would be to assess the patient and to plan and implement any orders that were given by the provider.
In this case, would the provider have been Dr. Russell?
Yes.
In front of you is a what I think are the nursing notes that you would have authored and others about Mr. Motor in the ICU. Do you recognize that to be the case?
Yes.
Okay. Let's talk about what that record indicates. The first thing you did for Mr. Motor was after he got to the ICU.
Can you repeat the question?
Yes. Looking at, can we call those, what do you want to call these, assessment notes, progress notes? What would you like to call them so we can refer to them in something familiar to you?
That's fine.
Which?
Assessment notes is
All
fine.
right, assessment notes. So can you tell me what was the first assessment that you made of Mr. Motor and what page we can find that on? And we've been using the page number right in the middle down there.
This one. So I believe the first thing I had noted was that he had arrived at 2045.
And what page would that be on?
That's going to be on 14.
All right. Give me just a moment to get there, please. All right. Now that page
And the
says
notes.
patient care activities, or
That-
should I be looking at flow sheet?
No, the patient care activities is where I'm referring.
All right. So is that your first assessment of Mr. Motor?
That would not be an assessment. That would be just general notes that we document as we go along in our patient care.
How did you know what it was that was Mr. Motor's problem in order for you to monitor it?
Given in report from the OR circulator nurse.
Do you remember what it was you were supposed to be monitoring about Mr. Motor?
It would be like vascular assessment, like pulses, capillary refill, anything that goes along with a vascular surgery.
And do you make a note of that?
At the initial assessment,
And if you find that for me, please.
I think it was this one. Yes. Page 6. Page 5 and 6 would be the initial assessment.
Now, if we look at page 5 and 6, where do we find that you made any assessment about, well, strike that. Let's go back to what time was your initial assessment?
Looked like 2200.
So would it be fair to say, if you can remember, that Mr. Motor got to the ICU about 8:30, so your first assessment would have been about an hour and a half later?
Yes.
And on page 5 or 6, tell me where you have made an assessment of his vascular
It
system.
would be on page 6.
Is it down in the right-hand
Yes.
bottom of the page?
Yes.
Read that to us.
Under cardiovascular, his left pedal pulse was absent, and his right pedal pulse was absent.
And was that at 2300?
That would have been at 2200
2200.
Mhm.
Okay. And where do I,
when the initial.
this is a little confused, where do I look to find it was at 2200? What page should I look at to figure that out?
On page 4 at the bottom right.
Where it says
2200.
2200? With your name there. Okay. So is that where your assessment starts, or is that just the time that you made the assessment about the vascular system?
The initial assessment would start when the patient hits the door as they're rolling in to the room.
Okay. Well, that's what I wanted to know. So that would have been, can you tell us what time that would have been?
At 20:45 when he was admitted.
All right. And do you make an assessment of the vascular system when he hits the door, so to speak?
Yes, but I didn't get to chart until the 2200 mark.
All right. Let me see if I understand you. So you're saying that at 2200, is that the time when there was no capillary refill in the pedal pulses?
Sorry.
That's okay. Or was it at 2045 when he first was admitted to the ICU?
So I was told in report from the OR circulator nurse that he had no pedal pulses. And upon my assessment of the patient, he had no pedal pulses.
Okay. So again, what the circulating nurse, did I say that right? Circulating nurse? What's her name?
I think Leah.
Who?
Leah.
Okay. And tell me what a circulating nurse does.
I believe they follow the patient through the OR. I don't exactly know.
But she's a person who reports to you the condition of the patient when she's or he is received in the ICU.
Yes.
Okay. And that circulating nurse told you when you received Mr. Motor in the ICU that he had no pedal pulses in the left and right foot.
Yes.
Okay. And once again, I just want to make sure, was this assessment made at 2200 or at 2045 when he was admitted to the ICU?
Well, the assessment would have been made when he was admitted, when I had a chance to receive report, get the patient settled in the ICU, hooked up to the monitors, all that stuff, and then begin my head-to-toe assessment.
Okay. But at any rate, the first assessment you made of his pedal pulses, right and left foot, were abnormal.
Yes, correct.
Now, you said also that when you receive a patient in the ICU that you have doctor's orders accompanying the patient. Did I hear you correctly?
Yes.
Can you find any doctor's orders anywhere in this record?
I don't know that there are orders. I don't recall if the care plan, like on page 11, would be classified as orders. Or if that was just what was already set up on the chart.
All right, let's break this down. Did you know that Mr. Mulder's right femoral artery had been torn in the operating room?
I do not recall getting that in report.
Would it be important for you to know that there might be a problem with adequate blood flow to his right leg when you got him in the ICU?
Yes,
Why?
because that would determine my assessment of the patient, or more detailed, focused assessment of the patient.
But you didn't know that.
Correct.
And you can't find any doctor's orders for you to monitor the blood flow to Mr. Mulder's right leg.
I don't know that these are orders.
Well, the question was you can't find any orders, doctor's orders, for you to monitor the blood flow to Mr. Mulder's right leg.
Same check.
There on page 11. Would be a care plan of things associated with the surgery. i.e. assess for signs and symptoms of bleeding.
Well, I see that.
Don't know that that's an order.
You don't know this is an order, but you also don't bleeding. Bleeding doesn't have anything to do with adequate blood flow to the right leg, though, does it?
Say it again.
Yeah. Looking for bleeding wouldn't have anything to do with whether there's adequate blood flow to the right leg, would it?
I'm not sure.
Let me show you this. Do you remember Mr. Mulder being in that condition in the ICU?
I don't remember that.
Would
Picture.
you say somebody who was in that condition would cause you to look for a risk of bleeding?
Objectable.
Possibly.
And who would have prepared the plan of care that we're looking at on page 11?
The doctor?
You think the doctor provided a plan of care?
I don't know.
Okay,
Sorry.
you don't want, that's all right. Let's go back to page 6. So the first assessment you made of Mr. Motor's vascular system, you've told me about, was to find there's no pedal pulses in the right or left foot. Now, what did you do when you made that finding?
When I what?
When you made that finding, which was abnormal, what are you supposed to do, or what did you do?
I was told that the provider was already aware that there were no pulses and no cap refill. And so I continued with the patient care and medications and ventilator.
All right, let's break that down. Who told you that the provider, are we talking about Dr. Russell again?
Yes.
Who told you Dr. Russell was aware at the time you received Mr. Motor into the ICU that he had no pedal pulses in either foot?
The circulating nurse that handed report off.
Okay. Who you think was
Leah.
Okay. And I assume this is a verbal report so that
Yes.
there wouldn't be any written documentation of what you just said.
Yes.
All right. All right, so you were told that Dr. Russell was aware that he didn't have any pedal pulses in right or left foot. When is the next assessment you made of Mr. Motor's right leg?
Would have been, I believe it was, let me go find it. Gets back this way.
And I might want you to look at page 8.
Right now?
Yeah, under skin temperature, you see that?
Yes.
Did you record cool lower body?
Cool lower body, yes.
What did that mean to you?
That his upper body and lower body were different temperatures.
Well, I know that, but what else did that indicate to you?
That there was vascular perfusion issues in the
And-
lower.
And did you call that to anybody's attention?
I believe this is the initial, so I did not.
So that would have been part of the initial assessment?
Yes.
Okay. All right. Now, I interrupted you when I asked you if you would mind finding the next time you recorded anything about Mr. Motor's right leg.
Would have the mini assessment.
And page, please.
I believe it's 2 is where it begins.
Page 2?
Mm-hmm.
All right. Give me just a moment to get there. All right, and show me what you have reference to.
Well, it's going. Under cardiovascular at the top right.
This is on page 2?
Oh, sorry, 3.
3.
3.
Okay. And tell me what you have reference to there.
So his pulses were still absent.
Where you see left femoral
Left.
pulse,
L-
right, excuse me just a minute, right popliteal pulse absent Doppler. Is that
Yes,
right?
yes.
Can you tell me what time this would have been?
This would have been around midnight.
And how do you know that?
It was charted around when I had made a note that would be on page let's go 13.
And where's the,
Page 13.
okay. What time?
It would have been around midnight, 0017.
All right, I see that. So that's when you think you noted no Doppler pulses that we just discussed?
Yes.
Who would have, tell me about Doppler, what is that thing?
It's like a little ultrasound-ish device that you use to go over the pulse to see if you hear it.
Now, do you do that?
Yes.
Okay. That means you performed this test
Yes.
at some time around midnight?
Yes.
And the last time that you had assessed his vascular system was on admission to the ICU.
Correct.
So is this condition now worse than it was when it was admitted to the ICU?
It just was not changed from the previous.
And so what did you do? I think you've written here, but tell me what you did when you made that finding.
I notified Dr. Russell that the pulses were still absent and no cap refill, cold to touch in both the right and the left, but that the left was sluggish cap refill and warmer to touch. And he stated that he was aware and he did not give me any new orders at that time.
Let's take this one at a time. How would he have been aware, if you know, prior to midnight?
He was aware that the patient had no pulse when he was first admitted to me,
Okay.
as I received in report.
All right, let's track that. So you didn't talk to Dr. Russell when he was admitted to the ICU, would that be correct?
Correct.
But the circulating nurse told you Dr. Russell knew about the pulse issues in his feet upon admission to the ICU.
Correct.
Okay. And that's what, when you said Dr. Russell's already aware, that's what you meant?
Correct.
And then you wrote no new orders. Why did you write that?
He did not tell me anything different to do or anything new to do.
Did that surprise you?
Yes.
Why?
I was expecting something to
Like-
do or assess for or change or
Why though?
because it was unchanged and the patient had not reperfused pulses after some interventions had already been done.
Now this says no new orders, which to me means there were prior orders of some kind. Is that what you intended when you wrote no new orders?
Yes.
Well, I haven't been able to find any old orders either.
I had made a note that I was transfusing a 6th unit of blood
Okay.
at 22:27.
Okay. So those were transfusion orders that you meant when you said that? That there are no new orders?
Yes.
All right. So tell me the next time you made any assessment of Mr. Mulder's right leg.
So that would have been at the 1 o'clock.
Or is it 12:45?
Well, it was at 12, it probably would have been around 12 o'clock when the assessment was made, and then I notified him at midnight 17
Yeah,
or around there.
okay. Did you call anybody else other than Dr. Russell at 12 o'clock or
At-
12:17?
When I hung up the phone, I had notified my supervisor of the situation and the phone call that was made.
And who was your supervisor?
Her name is Devin.
And you told her what your conversation was about with Dr. Russell?
Yes.
And what did she tell you?
She had notified the CNO, the chief nursing officer of the hospital, of the situation. And then they and I had all discussed it and agreed that the patient needed to be transferred to a higher level of care.
Was this all kind of at one time?
Yes.
Okay, so this didn't happen 30 minutes later. It's just happened when you hung up with Dr. Russell after you had reported to him what you've noted at 12:17. Then you called your supervisor. She called the CNO. And then that's when the decision was made.
Yes.
Oh, kind of all at one time.
Yeah,
Okay.
yeah.
And what's a CNO again?
A chief nursing officer.
And would she have been on the premises at that time?
She was not. She
Why-
worked day shift
Okay. Why is she brought into the picture?
because she's over all of the nursing staff at the hospital. And if the supervisor cannot or does not feel like she's adequate to control or make a decision, then she answers to her.
About the patient?
Yes.
Okay. Now, was Dr. Russell called again?
Yes.
Again, about the same time?
Yes.
Did you make the call?
I did.
And what'd you tell him?
That we felt that it was best if the patient was transferred to a higher level of care.
Did he ask you any questions that you can recall?
I don't recall.
Okay. Why did you feel it's necessary to transfer all three of you for that matter, transfer Mr. Moeller to a higher level of care?
We did not feel capable of, or we didn't feel like we had the resources there to help him anymore. And he was not regaining perfusion, and it seemed like nothing was being done about it. So we felt he needed to be transferred.
Nothing being done about it by Dr. Russell?
Correct.
Okay. Now, how long did it take from the time the decision was made to transfer him till he was transferred?
I'm sorry, repeat that.
Yes. After the decision was made that we've just talked about to transfer him to a higher level of care, how long did it take for him to actually leave the hospital for the higher level of care?
We got an accepting doctor somewhere between 1 a.m. and 2 a.m. and EMS was there at 3:50 a.m.
So almost 4 hours.
So a couple hours.
About 4 hours? From midnight to almost 4 a.m.?
Almost, yes.
Yeah. During that time, was anything done for Mr. Moeller to save his leg?
Don't believe, just an ongoing assessment.
Well, his leg didn't get any better, did it? During
Not-
that 4 hour period?
Not under my care, it did not.
Okay. Did you stay with him until he was transferred?
Yes.
Who called Vanderbilt to try to get him into Vanderbilt?
Dr. Russell would have made that phone call to get an accepting.
Why would the doctor be the one to do it?
They always have when I've been a nurse.
Okay.
A nurse has never called for an accepting.
All right. Do you agree that Mr. Mulder's leg was dying at midnight?
I could not say whether it was dying, but the pulses were not improving.
So what's the outcome going to be if the pulses don't improve? If you know.
I don't know.
Okay. Now, one last thing I would like for you to do is, if you will, to look, I think it's on page 15, because I believe that's where the vital signs are recorded about Mr. Mulder. Am I right?
Yes.
Are they all there?
Yes.
And are the times that are beside those vital signs pretty accurate?
Yes.
Did you ever have any reason after taking Mr. Mulder's vital signs to become concerned about his vital signs enough to call Dr. Russell?
These vitals look stable.
And if only if they're unstable would you be required to call the doctor?
Typically.
Okay. To your knowledge, did Dr. Russell ever inquire about Mr. Mulder's vital signs? At any time from the time he was admitted to the ICU until midnight?
I believe I had called him about sedation and the patient's sedation, not tolerating a medication because of blood pressure issues.
And I saw that. Is any other time that you might have called, had any reason to call Dr. Russell about Mr. Mulder's vital signs being unstable?
I don't recall.
Okay. And if you had done that, would it have been noted in the medical record?
Yes.
Okay. So can we assume that you didn't, since we can't find any note?
Correct.
Okay. That's all I have. Thank you.
All right, Ms. Feldhouse, my turn, I guess. My name is Keith Grant. I introduced myself earlier. I represent Dr. Russell in this case. At the time, I guess, that Mr. Mulder was admitted, you had been working about a little over 2 years, is that correct? I think you told me 17, and
yes.
so this is end of 19?
Yes.
Okay. And is that the only, at that point, was that the only nursing position that you had had?
Correct.
You made a mistake there. You didn't mean to say end of 19. This is end of 18.
I'm sorry, that's right. So it actually been a little less than 2 years, I guess, at that point.
Yeah.
Okay. I think with, not that my ability or my knowledge of time is good anyway, but with COVID, it seems like it has been 2 or 3 years this last year, so I think it's made it even worse. So you started in mid or early 17, so that at this point have been about 1.5 years that you've been working, correct?
Correct.
And that's the only position you had had since you had graduated from Tennessee Tech.
Correct.
Do you still currently work at Tennova Shelbyville?
I do not.
Where do you work now?
I'm at St. Thomas Rutherford.
Okay. What's the reason for, or why did you transfer?
Just wanted to broaden my experience as a nurse.
And what is your position at St. Thomas?
I'm in PACU,
Okay, so the
post-anesthesia care unit.
very good. So when folks come out of surgery, you monitor them until they wake up.
Correct.
How long when did you transfer to St. Thomas, or when did you leave? Let me ask a better question. When did you leave Tennova Shelbyville?
I think it was around April of 2019.
Okay. So about 5 months after this event.
Yes.
Does Tennova Shelbyville have doctors on staff 24 hours?
No.
Did they in 2018?
They had nurse practitioners.
Were there any nurse practitioners at the facility on December 6th or 7th of 2018 around midnight or in the late hours?
There would have been one.
Okay, and who was that?
I do not recall.
Do you recall if that nurse practitioner was ever contacted regarding Mr. Mulder?
I do not recall that. I don't.
Now, Mr. Kelly asked you earlier about not having an order in the portion of chart in front of you. And for the record, how many pages do you have in front of you?
15.
And do you know if that's the entirety of Mr. Mulder's chart that would have been kept while he was there during that December 6, December 7, 2018 time period?
From my understanding, yes.
Would there have been a section somewhere that has the orders in it that's separate from the nursing records that you have in front of you?
I don't know. This is the first time I've seen it printed like this.
Okay. And I was going to ask you that earlier about that. Had you looked through those records prior to coming here today?
Yes.
Okay. And when did you do that?
A week ago?
And when you looked through them, was it that set of records that you have, the 1 through 15?
Yes.
Okay. Have you looked at any other records of Mr. Mulder's?
No.
And who provided you those records?
Mm,
Mr. Kelly?
Mr. Kelly, yes.
And did you speak, I think you said you spoke to Mr. Kelly about this case prior to today?
Yes.
Okay. And what did you and Mr. Kelly talk about?
The chart.
Do you recall, well, how long was that conversation?
About 17, 20 minutes.
That's a very specific 17 minutes. How did you remember it was that specific?
I was nervous.
Okay. Was that on your cell phone?
Yeah.
Okay. Is that the first time you've probably talked to a lawyer about it?
Yes.
Yes. Did you go back and try to find any more records after you spoke with Mr. Kelly?
Just looking at the chart is all I did
Okay.
at this.
At the document you have there?
Yes.
Okay. And did Mr. Kelly provide those to you?
Mailed them
Mailed them to you? Okay. Was that prior to your conversation with him?
after.
After the conversation? Okay. And did you talk to him again after that?
No.
So just that one conversation that was 17 to 20 minutes that you all discussed,
Yes,
Mr.
sir.
Mulder?
Yes, sir.
Okay. And then after that, he mailed you a copy of the chart?
Yes, sir.
Or at least those documents in front of you?
Yes.
And then how long after you received those documents was it that you actually looked through the chart?
The next day.
And you haven't gone back to Tenova or anywhere else to find out if there are any other records involved in Mr. Mulder's care through this December 6 or 7, 2018 timeframe, correct?
I have not.
Does would Mr. Mulder's records also include the ER records, to your knowledge?
I don't know.
Okay. Do you know if they would include the OR records, so the operating room records?
In this chart,
Just in his chart generally?
the whole chart, it should.
Okay. And I guess that's what I'm trying to get to is what you have in front of you is not the whole chart for Mr. Mulder.
Correct.
And so when we're asking or talking about the orders, those may be in a separate part of Mr. Mulder's chart, correct?
Possibly.
Kind of like the same place where those OR records are going to be in a separate part of the chart, correct?
Possibly.
Okay. And they're not in that portion of the chart that you're looking at.
No.
Okay. So it's safe to say that there's going to be more records at Tenova Shelbyville involving Mr. Mulder's care from 12/6 and 12/7 of 18 than what you have in front of you, correct?
Possibly.
And when you talked about earlier that you said that no new orders had been given, that indicated to you that at some point orders had been given for Mr. Mulder, correct?
Correct.
Okay. In fact, if you didn't have orders, you wouldn't have known to check his pulses, correct?
Well, we check pulses on every head-to-toe assessment regardless of what the procedure is.
Do you do repeat checks, though,
Yes.
on every patient?
Yes.
What's the standard, or what's the, generally, when a patient comes in, how often do you check pulses?
We do an initial head-to-toe at least once per shift, and then every 4 hours we call it a mini assessment where we do like neuro, cardiovascular, respiratory assessment.
And how many times did you check, and I recognize that it's a head-to-toe, how many times while Mr. Mulder was at Tenova Shelbyville did you check specifically his lower extremity pulses?
3.
And in what time frame?
between 20:45 and 2.
So between 8:45 and 2 o'clock, you would have checked him 3 times?
Yes.
Okay, and that's more than just your standard pulse check, correct?
Correct.
And so in order for you to have checked it more, there would have to be an order somewhere that says to check it more than the standard every 4 hours, correct?
Correct.
Okay. And do you know who would have given that order? Would it have been Dr. Russell or someone else?
Probably Dr. Russell.
And we just don't know where those orders are currently, correct?
Correct.
Okay.
Sorry.
I'm not trying to harass you, but for
Sorry.
the court reporter, it makes it easier. When you called Dr. Russell the first time, it sounds like I think it was around midnight, is that correct?
Yes.
Did you use a hospital phone, cell phone? What did you call him from?
The hospital phone.
And do you recall how long that conversation was?
I don't recall the length of that conversation.
But he answered the phone?
He did answer.
Okay, and do you recall how you started that conversation? Did you start with, I've got Mr. Mulder and he's got these issues, or how did it start?
Typically, it starts with the patient name and the situation.
And so you would have started by telling Dr. Russell those things.
Yes.
Now, let me go back for a second. Mr. Kelly asked you if Dr. Russell had called in checking on vital signs. My understanding is that you all call the physician if there's an issue with vital signs, but the physician doesn't always call you all just to check in periodically. Is that correct?
Correct.
So if you all see an issue with vital signs or something you're concerned about, you'll call the physician.
Correct.
Okay. And the physicians typically depend on you all to do that, correct?
Correct.
And so going back to the conversation at midnight when you talked to Dr. Russell, you told him the situation with Mr. Mulder, correct?
Yes.
And do you recall specifically what you would have told Dr. Russell?
The only thing I recall is about his pulses still being absent.
Okay, in the lower
In the-
extremities?
In the right and left foot.
Okay, and were they absent in both at that point?
Yes.
Okay, and that's by pulsatile pulses and by Doppler in both extremities?
Correct.
Now, do you recall any questions that Dr. Russell asked during that first phone call?
I do not recall questions.
And I think you said you don't recall how long that conversation was.
I don't.
Do you recall anything that Dr. Russell said?
In the first phone call,
Yes.
just that he was aware of it
Aware of the
already.
pulses.
Yes.
Did you all talk about in that first phone call that there was some concern about you all not being able to provide the appropriate level of care for Mr. Mulder?
I don't believe so.
And do you recall anything else that that Dr. Russell said regarding what to look out for or whether or when to call him back?
No.
And then you had no, I guess then the next conversation you have with Dr. Russell was around 12:46, is that correct? And I may be off a little bit on that
Yeah.
time, but around that time frame?
Yeah.
Okay. And did you call him then?
I did.
And do you recall anything specific about that conversation?
Just that he had agreed at that time to transfer the patient to a higher level of care.
Okay. And did you discuss with Dr. Russell why the nursing staff felt that he should be transferred?
We did, and I believe that I had handed the phone to my supervisor to talk to him as well.
And was that Leah?
That would have been Devin.
Devin, okay. And do you recall anything specific that Devin said to Dr. Russell?
I do not.
Do you recall anything specific that Dr. Russell said to you prior to you handing the phone to Devin?
I don't.
Do you recall anything specific about that conversation at all that we've not
Just
talked
that
about?
he had agreed to transfer.
And did you all have a difficult time getting in touch with Dr. Russell that night, or did he answer the phone every time?
I believe he answered.
And then you said after that, Dr. Russell would have been the person who actually had or contacted Vanderbilt to get an admitting physician, is that correct?
Correct.
Okay, that's not something the nursing staff did.
Correct.
And that's not something you would have been involved with at all.
Correct.
So you don't know really what the logistics are as far as how that works, contacting another doctor.
I don't. We just get numbers for report.
Now, it looks like the records show that Mr. Mulder, everyone agreed to transfer him at 12:46, right?
Correct.
And then we had an accepting physician at 2 o'clock in the morning, correct?
Mhm.
Do you know why it was still another almost 2 hours or an hour and 50 minutes before EMS got there?
I do recall them having an issue with getting a portable ventilator on one of their ambulances.
Do you recall if it was EMS, the facility or the station that's just kind of next to Tenova Shelbyville that transported, or did somebody come from Nashville?
It would have been a Bedford County EMS, but I don't know what station.
Do you recall anything specific about this issue with having to get a portable ventilator?
I believe there was only one portable ventilator at the time, and they just had to make sure that it was functioning appropriately.
Okay, so they had one, they just had to make sure it was working.
Yes.
Did you talk to the folks at EMS, or did someone else talk to them?
I would have called for transfer.
And do you recall who you spoke with?
I do not.
Did you all follow up with EMS during that hour and 50-minute time frame saying, when are y'all coming, when are you going to get here, anything like that?
Typically, if it takes longer than 30 minutes, we call them back.
Okay. And do you, I didn't see in the record here, do you know if anyone called EMS back during that time frame?
There would have been like our secretary monitor tech to do that while we were doing patient care.
So the nursing staff wouldn't be involved with that, someone else would have taken care of the
We would have
logistics?
delegated.
Would that be put in the record anywhere?
Probably not.
Had you ever heard of that issue coming up before where the Bedford County EMS had to make sure they had a working ventilator?
I have not.
You may not remember this specifically. How many patients would you have been taking care of on the night of December 6th through the morning of December 7th?
Up to 2.
2 would be it?
Two would be the max.
Okay, so Mr. Mulder and then one other patient.
Correct.
Do you recall, I don't want the name or anything, but do you recall if there was another patient actually there that night?
That I was taking care of?
Yes, I'm sorry.
I do not recall.
And did you talk to any other physicians that night about Mr. Mulder?
Yes, I had contacted Dr. Patel.
Okay, and who's Dr. Patel?
He is the pulmonologist.
And when did you contact Dr. Patel?
I contacted him 2 minutes after the patient had first arrived, so at 20:47, I gave him a phone call.
Was this before you had contacted Dr. Russell?
Yes.
Okay, and why did you contact Dr. Patel?
At that time, it was for ventilator settings.
And I noticed something in the record about Dr. Patel said something about he wasn't going to be on call for that patient all night or something like that. Do you recall that?
Yes.
And do you recall why Dr. Patel made a statement like that?
I do not.
Give me 1 second, I may be about done. What else you got? Okay. That's all. Thank you, ma'am.
Thank you.
I'm going to take a short break, and I've got a few more questions.
This concludes the No, sorry.
Pause.
Going off the record, time on the monitor is 14:45. Back on the record, time on the monitor is 14:48.
Nurse Feldhouse, I want you to go back to, let me get this page here. Unless you can find, no, I know where it is. It's on page 6. And you correct me if I'm wrong. If I understood you, this is the first time you've made an assessment of his capillary refill in his on his feet, pedal pulses.
Yes.
And this is so important. I got to know what time that was. So I think you told me I made this assessment as soon as I received him into the ICU, which we've established was 8:45. So is this at 8:45 or 9 o'clock?
It would have been somewhere between 8:45 and 10 o'clock.
Okay. But that's as close as we can come.
Yes.
Okay. Now I want you to go to page 14. I want to ask you about what the statement you made about Dr. Russell's orders. It appears the first time you talked to Dr. Russell would have been, and this is on page 14. You see where it says call Dr. Russell and he gave orders to restart propofol?
Yes.
I haven't been able to find any other time that you may have called Dr. Russell in this record before this time. And that's the only orders I see that you have recorded that Dr. Russell gave you about Mr. Mulder. Do you know of any others?
I don't recall any others.
Okay. I mean, is it your job to record things when you have a conversation with the doctor about what the doctor's told you about the patient?
A phone call, yes.
Okay. How did you know what number to call Dr. Russell on?
We had a log of all the doctors' cell phone or home number.
And then the other thing I wanted to ask you is, once you've, at sometime between 8:45 and 10 o'clock, recorded an abnormal finding about his pulses, does that trigger a more frequent assessment of his pulses than you otherwise might do?
Yes.
And you don't have to have an order to do that, do you?
It would just be nursing judgment.
Okay. And you did that?
Yes.
You monitored him more frequently because of what you found in your initial assessment?
Correct.
Okay. That's all I have.
I have a few follow-up from that. You probably expected as much. Is it noted anywhere in the record, Ms. Feldhaus, that you did extra assessments or more assessments because of your prior findings?
Other than the notes that were made, the phone calls, no.
Okay. And what I'm asking about is Mr. Kelly said sometimes you can get a sign or symptom, and in this case, you actually felt the pulses and had absent pulses. Is there anything in the record to say that because of those absent pulses that you increased the time frame of when you would actually check his pulses?
State it again.
Sure. Mr. Kelly asked you about what would maybe prompt you to check Mr. Mulder's pulses more frequently, correct?
Correct.
And I think he asked that if you have a finding such as no pulses, then that might cause you to increase the frequency with which you check pulses, correct?
Correct.
Now, do you know for sure that that's why you checked Mr. Mulder's pulses more than the standard 4 times in this case?
Excuse me, she didn't say 4 times, she said every 4 hours.
I'm sorry, that's right. Every 4 hours, that's right.
There was no change to the pulses from the initial assessment and what I was told in report, and to the midnight hour, there was no change.
Okay, and I guess, let me see if I can get a better question because I'm not asking the right question. It's completely my fault. I think you told me earlier that typically in a patient, you assess them every 4 hours, you would check pedal pulses, correct?
Correct.
Mr. Mulder, you check his pedal pulses more often, correct?
Correct.
Okay. Is there anything in the record that says why you checked Mr. Mulder's pulses more often?
Just that it was a vascular surgery would prompt me to check them more.
Do you know if
frequently.
I'm sorry, I
Sorry.
didn't mean to talk over you, I thought you were done. Do you know if there's an order somewhere that told you how often to check pulses with Mr. Mulder?
I don't remember seeing one.
Do you know if there were any standing orders from Dr. Russell as to how often to check pedal pulses?
I don't remember seeing that.
Let me hand you Oh, are the orders typically, are they on the computer in the MAR system, or do doctors handwrite the orders?
They're typically in the computer,
Okay, so there's not like a handwritten order like doctors used to do?
not usually
Do you know?
now.
Okay. How about back in 2018, December?
I think most of the time they were in the computer.
Let me hand you, I'm going to put my mask on just in case, but let me hand you. And these are Inova Healthcare Shelbyville 94 through 100. Let me hand you these documents.
Okay.
And do you recognize those documents? And I'll give you a minute to look those over. Yeah.
You said, do I recall them?
No, I guess just tell me initially what they are.
Oh, sorry.
It's okay.
It's an order set.
And are those, is that order set involved with the care and treatment of Mr. Mulder?
Yes.
Okay. And what physician actually made those orders?
Dr. Russell made some, and Dr. Patel had made some.
Okay. And does that indicate to you that somewhere at least there are orders from Dr. Russell regarding the care and treatment of Mr. Mulder?
Yes.
Now, I'd recognize that those were not in the 15 pages you had before, but do you, after seeing that, believe that there are orders somewhere in Mr. Mulder's chart from Dr. Russell?
Yes.
In my understanding, I think what happens is the orders come through the computer, and then you all acknowledge the orders on the computer and then acknowledge what action you've taken based upon those orders, correct?
Correct.
Anything else? That's it. Thank you.
Nurse Fieldhouse, you looked at all those orders. Did you see any order from Dr. Russell to monitor the pulses in Mr. Mulder's right leg? Or to check for the perfusion of blood in his right leg, or anything to do with his right leg? Make it that simple.
I do not.
Last question. In your training as a nurse, do you rely on what you are told by the circulating nurse when you receive a report in providing care to your patient?
I do, to an extent.
To what extent would you not?
Well, we have to trust that what they're telling us is true.
I understand that, but do you rely on those statements in order to providing care to the patient as
would-
being true?
Yes.
Okay, thank you.
Thank you for you go.
Okay.
Get up and run. Oh, we think something
This
else.
concludes the deposition. Time on the monitor is 14:58.